Thank you for this interview opportunity. My goal is to let you know that I'm the best candidate for this job. I'm Candy Hughley, and I have lived in Knoxville for 20 years. I feel my experience gives me the competency and knowledge to be an excellent candidate for this position. Community health has always been my passion. I've been a registered nurse for over 25 years. I'm in school now to obtain my bachelor's degree. My primary goal for this additional education is to shift my nursing role into this area. Community health is important to me because it deals with promotion of health issues and prevention of illness. I was very fortunate to have community health nursing as one of my first semester courses at the University of Tennessee. This clinical experience are what gave me the broadened horizon of Knoxville's community service. There are many services available in Knoxville. My mission will be to grow these services utilizing resources to the maximum for health promotion and maintenance. I will propose to you many ways I can accomplish this, with the prevention of illness being the key. I participate in health fair, held at a job location, do community health nursing, and feel like this was such a beneficial thing to provide their employees. I want more of these in action. This will require limited funding, as most providers of the health fair are marketing their product as volunteers. It gives employees a chance to have a health assessment and evaluation. We will approach employees with this opportunity and explain the benefits. We will then acquire a database of service providers willing to participate in these health fairs. Smoking cessation information booths, along with booths that measure body mass index and blood glucose monitoring, are events I would like represented every health fair. I will also be sure booths regarding physical activity opportunities are available. Tennessee is ranked 42nd in the international health rankings. In the past 10 years, obesity has increased from 22.9% to 31.7% of adults, with 2 million obese adults in the state. Change in Knoxville alone can make a difference in these statistics, and my goal will be to start here in the workforce. Health fairs provide a simple, coordinated way to implement health risk assessments, educate employees about healthy living practices, and demonstrate an employer's commitment to health and well-being. Medical insurance, as often supplemented by most employers, will show a decrease in claims, and more employees will lose weight and stop smoking, which in turn will make them a more productive employee. Knoxville's Lost Sheep Ministry is an area I will expand. The mobile dental service was very impressive to me. I witnessed tooth extractions and routine dental care for the underprivileged. Dr. O'Rourke and team perform these services free of charge. My goal is to enlist physicians and nurses to volunteer for a similar service with a mobile medical trailer. This will have the cost of providing the trailer and equipment, but with volunteer services, it will be cost effective with the promotion of health care and prevention of illness. When I served as a student at this organization, there are regular patrons that had their blood pressure cards recorded for weekly fluctuations along with weekly glucose monitoring. Many were hypertensive and hyperglycemic and never received medical care. My goal is to at least have monthly access with a medical doctor or nurse practitioner that can provide these patients with needed care. Certainly the homeless population cannot afford medications, so I plan to lobby pharmaceutical companies and representatives to get sample packets of medication for treatment of diseases such as hypertension and diabetes, and have these ready to dispense by the physician or nurse practitioner on a monthly basis. We will get to experience positive feedback as we see their conditions improve with weekly follow-ups at the medical tent. There will be a reduction in the amount of homeless people needing emergency medical intervention for these illnesses with our medical management. There are many opportunities in this town for fitness promotion. The Knoxville Track Club offers many levels of fitness participation, We'll have Fleet Feet Sports and Runners Market offering programs as well. Although effective, each of these require membership or fees. My goal is to implement a Let's Move Knoxville theme that welcomes all fitness levels. We will advertise this to promote attendance to walk or run in weekly events of varying distances hosted by our town that we will hold at multiple popular community areas with a volunteer leader at each location. We will pair people with a buddy to enhance participation and accountability. Motivation will come to the participants as they begin to see results in their health. We will challenge all participants to participate in a Knoxville Marathon event, which have 3.1, 13.1, and 26.2 mile options, and offer a discounted fee. We have great greenway resources that can be utilized for this cause. Parks and recreation establishment in Knoxville is well above the average town. Our role here is to be able to maintain what has already been accomplished and utilize these greenways to the maximum in benefit of our town. We will see a rise in fitness levels in Knoxville as we have hundreds of people join Let's Move Knoxville team and encourage them to log weekly miles with the goal of getting 25 miles per week in their logbook. By reaching out to just 10 additional people through advertisement and word of mouth, we could have over 500 members in a year. My vision for Knoxville is to have a healthier community. Promotion of exercise and obesity prevention, along with diabetes management, will be important. I would like the homeless to have access to routine medical follow-ups and prevent hospitalizations through prophylactic measures. This will be reflected as a decrease in medical needs for our population, along with decreased hospital admissions. Finally, my management style is important in your decision because you will hire the most qualified applicant. I have compassion and I lead by example. I will manage finances and implement and follow a budget. My primary focus will be leadership. I assure you that every person I attain and hire will be respected and be a part of the team I build. Leadership is essential. Most of the programs I suggest requires volunteer services. I'm a strong candidate for this position because I will recruit these volunteers and keep costs to a minimum. I'm a people person and require that same approach from my team.